The liver is one of the most important organs in your body, yet many people overlook its health. Do you know if your liver is in danger? Chances are, unless you're feeling very unwell, you haven't given it much thought. The truth is, the liver plays a huge role in keeping your body running smoothly. From detoxifying harmful substances to helping digest the food you eat, it works quietly in the background. However, liver damage can creep up without showing obvious signs until it's too late. That's why recognizing symptoms early is so important. In this video, we will walk you through 17 critical symptoms that may indicate liver damage. Some of these signs are subtle, while others are more severe. But all of them point toward the same problem: your liver might be suffering. We'll also dive into what causes liver damage, who's at risk, and what you can do to keep your liver healthy. If you want to protect your liver, stay tuned for the full breakdown. The liver's function in the body. Before we get into the symptoms, it's important to understand just how vital the liver is to your overall health. This large, reddish-brown organ sits on the right side of your body, just below your ribs. Weighing around 3 pounds, the liver is a powerhouse when it comes to keeping your body functioning properly. But what exactly does it do? The liver has several essential functions. First, it acts as a filter. Every time you eat or drink something, your liver processes it. It detoxifies harmful substances, breaks down nutrients, and turns them into energy for your body. For example, when you drink alcohol, the liver works hard to break it down so it doesn't damage your cells. Secondly, the liver produces bile, which helps digest fats. Without bile, your body would struggle to absorb fats and fat-soluble vitamins from food. That means your body wouldn't get the nutrients it needs to function properly. Additionally, the liver stores important vitamins and minerals, including iron and vitamin B12. It also plays a key role in regulating your blood sugar levels by converting excess glucose into glycogen, which it stores for later use. These are just a few examples of the liver's many responsibilities. So, as you can see, when your liver isn't working properly, it can affect almost every part of your body. Now that we understand how important the liver is, let's dive into the symptoms of liver damage. Early symptoms of liver damage. Liver damage doesn't happen overnight. In many cases, it starts slowly, with early symptoms that are easy to ignore or mistake for something else. But recognizing these signs early on is crucial because, with the right treatment, liver damage can be stopped or even reversed. Let's take a look at some of the first signs that your liver might be in trouble. Symptom 1: fatigue and weakness. Fatigue is one of the most common symptoms of liver damage, but it's often dismissed as a normal part of life. Many people feel tired, but when the liver isn't functioning properly, it has to work harder to keep your body running. This can lead to constant exhaustion and feelings of weakness, even if you're getting enough sleep. If you're finding it difficult to complete your daily activities without feeling drained, it might be time to pay attention to your liver health. Symptom 2: loss of appetite. Another early sign of liver damage is a sudden loss of appetite. When the liver is inflamed or injured, it affects your digestion. You may feel full more quickly than usual or have no interest in eating at all. This can lead to unintentional weight loss, which is also a cause for concern. If you notice a consistent lack of appetite without an obvious reason, it's worth considering whether your liver might be to blame. Symptom 3: nausea and vomiting. As liver damage progresses, nausea and vomiting can become more frequent. This is because the liver helps filter toxins from your blood. When it's not functioning properly, toxins build up, leading to feelings of nausea. Some people may experience occasional vomiting, while others might feel nauseous all the time. This symptom can be mistaken for a stomach bug or indigestion, but if it persists, it could point to a liver issue. Symptom 4: jaundice, yellowing of the skin and eyes. One of the most noticeable signs of liver damage is jaundice. This occurs when there's a buildup of bilirubin, a yellow pigment, in your blood. Normally, the liver processes bilirubin and removes it from the body. But when the liver isn't functioning properly, bilirubin accumulates, causing your skin and the whites of your eyes to turn yellow. Jaundice is often a clear sign that something is wrong with your liver, and requires immediate medical attention. Symptom 5. Dark urine and pale stool. If you notice that your urine is darker than usual, even though you're well hydrated, it could be a sign of liver damage. Dark urine can occur when the liver isn't able to properly filter bilirubin. Similarly, pale or clay-colored stools may indicate that your liver isn't producing enough bile. If you see changes in your urine or stool color, don't ignore them, as they could be early indicators of liver problems. These early symptoms might not seem severe, but they are warning signs that your liver is struggling. If you notice any of these issues, it's important to consult a healthcare professional to assess your liver health. Advanced symptoms of liver damage. As liver damage progresses, the symptoms become more serious and harder to ignore. These advanced signs are often an indication that the liver is significantly impaired and that medical intervention is necessary. Let's take a closer look at some of the more severe symptoms of liver damage. Symptom 6. Swelling in the abdomen, ascites. One of the more noticeable signs of advanced liver damage is ascites, which is the buildup of fluid in the abdomen. This occurs when the liver becomes scarred and blood flow is blocked, causing fluid to accumulate in the belly. You may notice your abdomen becoming enlarged and uncomfortable, even though you haven't gained weight. In severe cases, the swelling can cause pain and difficulty breathing. Ascites is a serious condition that requires medical attention. Symptom 7. Swelling in the legs and ankles, edema. Similar to ascites, edema is the buildup of fluid, but in this case it occurs in the legs and ankles. When the liver is damaged, it struggles to produce proteins that regulate fluid balance in the body. As a result, excess fluid can pool in the lower extremities, causing swelling. This swelling may be more noticeable after long periods of sitting or standing. Like ascites, edema is a sign that the liver is not functioning properly. Symptom 8. Unexplained weight loss. While some people with liver damage experience weight gain due to fluid retention, others may experience unexplained weight loss. This can happen when the liver is unable to process nutrients from food, leading to malnutrition. If you're losing weight without trying, especially if it's accompanied by other symptoms like fatigue or nausea, it's important to consider whether your liver might be the cause. Symptom 9. Itchy skin. Another surprising symptom of liver damage is itchy skin. When the liver isn't functioning properly, bile salts can build up in the skin, causing persistent itching. This itching can be mild or severe, and often gets worse at night. In some cases, people with liver damage may notice small, red spots on their skin, which are caused by broken blood vessels. If you have ongoing, unexplained itching, it could be a sign of liver issues. Symptom 10. Abdominal pain and discomfort. Many people with advanced liver damage experience pain or discomfort in the upper right side of their abdomen, where the liver is located. This pain can be dull and aching or sharp and severe. It may come and go or be constant, depending on the extent of the liver damage. If you're experiencing ongoing abdominal pain, especially if it's accompanied by other symptoms, it's important to see a doctor to rule out liver disease. Symptom 11. Chronic fatigue. While fatigue is an early symptom of liver damage, it often becomes more severe as the condition worsens. Chronic fatigue can make it difficult to get out of bed or complete daily tasks. This extreme tiredness is a result of the liver's reduced ability to filter toxins and produce energy. If you're constantly feeling exhausted, even after getting plenty of rest, it could be a sign that your liver is failing. These advanced symptoms indicate that liver damage has progressed and that medical intervention is needed. Don't ignore these signs. If you're experiencing any of them, it's important to seek medical attention as soon as possible. Critical symptoms that require immediate attention. In the most severe cases, liver damage can lead to life-threatening complications. These critical symptoms are signs that the liver is failing and that immediate medical attention is needed. Let's go over the symptoms that should never be ignored. Symptom 12. Easy bruising and bleeding. One of the liver's many functions is producing proteins that help your blood clot. When the liver is damaged, it struggles to produce these proteins, which can lead to easy bruising and bleeding. You may notice that small injuries result in large bruises, or that you're bleeding more than usual from minor cuts. In severe cases, internal bleeding can occur, which is a medical emergency. Symptom 13: confusion and cognitive changes. One of the significant signs of liver dysfunction is confusion and cognitive changes. This symptom can manifest as difficulty concentrating, forgetfulness, or an overall sense of mental fog. When the liver is compromised, it struggles to filter toxins from the blood. These toxins can build up and affect brain function, leading to disorientation and confusion. You might notice yourself struggling with simple tasks or forgetting important information. In more severe cases, personality changes or unusual behavior may occur. If you or someone you know is experiencing these cognitive changes, it is crucial to seek medical attention as soon as possible. Symptom 14: seizures. In severe cases of liver damage, the buildup of toxins in the body can lead to seizures. This is a serious condition that requires immediate medical attention. Seizures can vary in intensity and may be the first indication that the liver is failing. If you witness someone having a seizure, call emergency services right away. Symptom 15: high fever and chills. A high fever and chills can be a sign of infection, which can occur alongside liver damage. This symptom may indicate that your body is fighting off an infection in the liver, such as hepatitis. If you experience a sudden high fever, especially when combined with other symptoms of liver damage, it's important to seek medical help immediately. Symptom 16: nausea with vomiting blood. Nausea is a common symptom of liver damage, but if you're experiencing vomiting that contains blood, it's a sign of a serious problem. This could indicate internal bleeding, which may result from severe liver disease. If you vomit blood or notice blood in your stool, you need to seek emergency medical care right away. Symptom 17: coma. In the most extreme cases of liver failure, a person may fall into a coma. This occurs when the liver can no longer remove toxins from the blood, leading to severe brain dysfunction. A coma is a medical emergency and requires immediate intervention. These critical symptoms are signs that your liver may be in serious danger. If you or someone you know experiences any of these symptoms, don't wait. Seek medical attention right away. Causes of liver damage. Now that we've covered the symptoms, let's discuss some common causes of liver damage. Understanding what can harm your liver is crucial for prevention. There are several factors that can contribute to liver damage, including alcohol consumption. Excessive alcohol consumption is one of the leading causes of liver damage. Chronic drinking can lead to fatty liver disease, alcoholic hepatitis, and eventually cirrhosis. It's important to drink in moderation and be aware of the risks associated with excessive alcohol use. Obesity. Obesity is another significant risk factor for liver damage. Excess body fat can lead to non-alcoholic fatty liver disease, NAFLD, which can progress to more serious liver conditions. Maintaining a healthy weight through diet and exercise is essential for liver health. Viral infections. Viral hepatitis, including hepatitis A, B, and C, can cause significant liver damage. These infections can be contracted through contaminated food or water, sharing needles, or sexual contact. Vaccines are available for hepatitis A and B, and antiviral medications can help manage hepatitis C. Medications and toxins. Certain medications and environmental toxins can also damage the liver. Over-the-counter pain relievers like acetaminophen can cause liver damage when taken in excess. It's important to follow dosage instructions and be cautious with any medications. Autoimmune diseases. Autoimmune diseases, such as autoimmune hepatitis, can cause the body's immune system to attack the liver. This can lead to inflammation and liver damage. Treatment for autoimmune hepatitis often includes medications to suppress the immune system. Genetic disorders. Some genetic disorders can affect liver function, such as hemochromatosis, which causes the body to absorb too much iron. This excess iron can accumulate in the liver and lead to damage. Genetic testing can help identify these conditions. By understanding the common causes of liver damage, you can take steps to protect your liver and reduce your risk. Who is at risk? While liver damage can affect anyone, certain groups of people are at a higher risk. Understanding these risk factors can help you assess your own liver health. Some individuals who may be more susceptible to liver damage include heavy drinkers. Those who consume excessive amounts of alcohol on a regular basis are at a much higher risk of developing liver disease. Alcohol abuse can lead to a range of liver issues, including fatty liver, hepatitis, and cirrhosis. Obese individuals. People who are obese or overweight have a greater risk of developing non-alcoholic fatty liver disease. This is especially true if they have a sedentary lifestyle and poor eating habits. Additional resources. 1. American Liver Foundation, ALF. The American Liver Foundation provides extensive resources, education, and support for individuals affected by liver disease. Their website offers information on liver conditions, treatment options, and ways to promote liver health. 2. Centers for Disease Control and Prevention, CDC. The CDC provides guidelines on liver health, vaccination information for hepatitis, and recommendations for safe alcohol consumption. Their resources can help you understand how to protect your liver and stay healthy. Third National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK. NIDDK offers research-based information on liver diseases, their causes, symptoms, and treatment options. They also provide educational materials to help you understand the importance of liver health. If you found this video informative, please consider subscribing to our channel for more health-related content. Hit the notification